I'm Thomas Baldrick at ASH 2014, joined by Dr. Gia Ruan from Cornell. Thanks for stopping by and visiting with us.
It's my pleasure.
Let's talk about your study with lenalidomide plus rituximab as initial treatment for mantle cell lymphoma. Give us an overview of what you've done with this.
Sure. It is a phase 2 study and utilize a combination of lenalidomide plus rituximab, two agents that are non-cytotoxic. So it's chemotherapy-free combination, which are provided to patients as induction treatment as well as maintenance therapy.
And what were the key findings?
I like to also provide you with a description of how the study treatment was provided before we move on to the response findings, because I think that's one unique aspect of this particular study. So unlike traditional chemotherapy, which provided with finite number of treatment courses, this particular treatment has two phases. One is the induction phase. Initially, patients were provided with the combination of lenalidomide, which is a pill, taken 3 weeks on, 1 week off for each treatment cycle, plus rituximab, which is the infusion that were given once a week for 4 weeks and subsequently at regular interval every 2 months. And patients would be treated for about a year as the duration of the induction. If they show responses, they may continue the therapy and move on to the maintenance phase. The maintenance phase design was very similar, with the exception of lenalidomide, which is a pill. The doses would be reduced to allow long-term exposure to those combinations. And I think the study finding appears to be rather encouraging because in patients which generally are unselected, they're just coming from community, some are quite elderly, which is kind of reflective of mantle cell lymphoma, this particular subtype of non-Hodgkin B-cell lymphoma, because median age was about 65, so majority of the patients you would think would be relatively elderly and have a lot of comorbid medical conditions, some of whom may not be very good candidates for conventional chemotherapy. So I think the result seems to be rather encouraging for this biologics-based treatment, because we have seen overall response rate of over 80% and complete remission rate at over 50%. Those are numbers that are comparable to combination chemotherapy. And because of this induction as well as maintenance regimen, I believe that it really contributes to a rather meaningful and durable responses. We have patients stay on this treatment on average over 2 years, and we have not seen a median, progression-free survival yet, which means the majority of the patients remain to be in their remission status, doing well.
How did you come to choose this drug combination?
Well, that's a very good question, and it has a fairly long, proven clinical history, because each of those individual agents, namely rituximab, which is an infusional antibody against B cells, it's anti-CD20, and the second agent, lenalidomide, which is a oral pill, and it's immune modulatory compound. They have demonstrated individual activity against mantle cell lymphoma, primarily in the relapse setting. And as you know, FDA has approved lenalidomide as a treatment option for relapsed mantle cell lymphoma. And we also know that the combination of them seems to be feasible in relapsed mantle cell lymphoma patients with a respectable response rate. So we thought, why not try in the frontline setting, especially if they do have activity, then patients who may generally not chemotherapy candidate could potentially benefit from this particular combination. And we seems to be seeing that treatment effect.
Where do you go from here?
Well, I think first probably needs more time for this study result to borne out. And secondly, I think probably would require a larger study and possibly with a comparison as well, with other biological compounds, or used as a treatment platform to incorporate other biologics, as combination to see, if that would continue to improve the treatment outcome. And I think in general, it really is a proof of concept type of work to show that mantle cell lymphoma can be sensitive to biologics, and patients could certainly benefit, from this new option.
Dr. Ruan, thanks for sharing your news with us, and good luck to you.
Thank you. It's my pleasure.